one, take two. Every year. I was last 3 years. You said which area? Well, no, that's not for me. I think it's funny. So I went around. We went all there. We got back. Coming back, you know, it was almost time for church to be over. So really want nobody else. And I was just going to be like, Pass the house. And he said, hey, come here. Yeah. He like, oh, since church, you know, so he like, take two more. I'm like, bet. I thought about it.
Okay, let's start. Let's talk about the PTCE. So eye on the prize, okay? Freshmen, just so you know, our state, Nevada, doesn't require you to take the board exam to work as a pharmacy technician. Okay. The only requirement for you to become a pharmacy technician on top of your training is to be registered with the Nevada State Board of Pharmacy as a pharmacy technician. However, it is catch-22. Why catch-22? Many employers require you to have the CPhT title, specifically from the PTCB, to be nationally certified. There are a lot of advantages taking the board exam, either the PTCE or the ExCPT. Okay, higher pay, more opportunities, raise, growth. You cannot work, this is one thing I know, fact. You cannot work in a hospital here without passing the PTCE, without having the title CPhT after your name. Okay. Have 100% pass rate on the PTCE. No pressure. And so what I'm trying to say is you're in good hands. We give you everything you need and more, okay? And I keep up with the changes. This change happened in 2020. It used to be 9 domains, but they just compressed it. So I'm going to discuss the latest. This is what you call the blueprint, okay? The latest blueprint on how PTCB will test you. Okay, and the topics that you should know when you are interested, if you are going to take the PTCE. There are 4 major topics. They call it knowledge domains. Okay, 4 major topics, knowledge domains. If I'm going to put this into 4 classes, this will be pharmacology, pharmacy math or calculations, pharmacy law, and the last one will be compounding, both sterile and non-sterile. Okay. Pharmacy law would include your inventory, tech duties, etc. So let's piece this. Okay. Like I said, I take it seriously. I even highlight it. I want to make sure that I cover most of it. Okay. I've been teaching for 15 years. I've been here at Pima for 14 years. I took the test myself, both tests. And students come back, of course. The first person they text when they pass is me. I got pictures of their passing score because it's an automatic, there's a printout of a pass or a fail once you take the test. Over a manhole. I said, where are you? I cannot help it. I said, we got in an accident. Like, I wanted to send you my pass score. I said, don't do that. All right. I get the first result before their parents or their partners. Okay. And then they come here and I ask them to speak. What did you see? Okay. Though you will sign a waiver after the board exam saying you are not to talk about it for 2 years, I think, or 3 years. So after that time I took the board myself, I didn't talk about it, but I started building references. Okay. But it was more just a validation of the materials that I have. Okay. And for me to be able to walk and say, you're right. PTC, or they're right in the forum. PTCE is more difficult than ExCPT. Okay, so let's talk about the 4 knowledge domains that PTCB said. Medications is 40%. That's why many test takers fail. Because they just tried to memorize the top 200 drugs, but they didn't understand the drug-to-drug interaction. They didn't understand this, the drug-to-food interaction and drug-to-disease interaction, and why they happen. Okay. So when I teach pharmacology, I start with this one all the time. And then I talk about anatomy and physiology of whatever system. We talk about the organs, and then the diseases that cause problems to those organs, and then the drugs that treat those diseases. So you have a better understanding. And you're not like parrots, just mouthing, brand generic therapeutic class, brand generic therapeutic class, brand. You trip, you forget. After a test, you forget. You want it to be long-term, so I tell stories. I tell words to look for or look at to remember them. I draw the ugliest drawings in the world so you'll remember. I don't draw it ugly because I do it on purpose, because I don't know how to draw. Okay, let's start with medications. First one, generic names, brand names, and classifications of medications. Not including the freshmen. Do we cover this in pharmacology? Yes, you have a weekly drug words test, an abbreviation test. For it not to be overwhelming, it's an average of 10 drugs a week. Yeah. Even if you don't have a pharmacology class, I set that schedule. I set that pace with Ms. J. Why? Because I want it to be continuous. Consistency is the key. I don't want you to just studying drugs when we have a pharmacology class, which is 3 weeks. It goes on and on and on. Okay. Consistency. Okay. It gets me all the time. Okay. You want to study drugs, and it's not all over the place. So right now, sequence 3, what did you just get? Endocrine and urinary. So the drugs that we will be studying will affect the hormones. It's about hormones, the endocrine system, okay? And the genitourinary system. So we're going to talk about female reproductive and male reproductive organs, the drugs that affect that. And your drug words test, I made your quizzes, Miss J made the Kahoot. It's going to be related to that. So you're not studying all over the place. Oh, it's cardio. But you have to remember, each of these organs may have some pain, may have some infection. So pain meds will always be included in every sequence, and antibiotics will always be included in every sequence. Okay, are you following? Okay, generic names. Therapeutic equivalents. Are we talking about the different classes and the other, what are the classes that help with hypertension? Right? We did that sequence too. ACE inhibitors, ARBs, right? You remember that? Different classes, but they treat hypertension. Beta blockers, therapeutic equivalents. Common and life-threatening drug interactions. I just talked about some today. Drug to disease, drug to drug. Drug to disease, liver damage, usually those people with liver damage, kidney problems. They cannot take certain medications, or their medications have to be adjusted, recalculated, lower dosing. You following? Okay. Drug to drug. SSRIs and MAO inhibitors. Okay. Drug to dietary. MAO and aged cheese and meat. MAO inhibitors. What else? Warfarin and leafy greens. All right. We cover this. And then make sure I don't forget. And it's at the back of your book, drug interactions. Okay. What was that? Theophylline and caffeine.
Yeah.
Very good. Dosage forms. I talked about this. Routes or routes of administration. Why it's important. Why it matters. Special handling and instructions. Why heparin cannot be given by mouth. Because it's destroyed by stomach acids. That's why it's given intravenously. Okay? Duration of the drug therapy, half-life, bioavailability. Common and severe medication side effects, adverse effects, and allergies. Euphotropium, peanut allergies. Okay, we learned that last sequence. Side effect of acetaminophen or Tylenol? Liver damage. It always shows up. Side effect of NSAIDs? Gastric irritation or bleeding. Indications of medications and dietary supplements. You're going to learn about CAMS, complementary and alternative medicine. This is one of the students' favorite sequences because they create something. Okay. Euphoria, you remember what you made?
I made a face scrub.
She made a face scrub. Out of, what are your ingredients?
I did rosemary, turmeric powder, yucca root, which is it makes the soap
Powder, yeah.
Mm-hmm.
Powder form.
Sulfur, and then water. I think that's.
This is the only school where your teacher takes you to an herb store. Not even Roseman. They were in shock when we walked in there the first time. Like, a pharmacist? Because they always think that we just do a certain medication. Okay. This is not given focus in pharmacy school. But the world is changing again, and I want you to be in touch with that and be updated. Okay. Complementary medicine shows up every now and then on tests like St. John's wort. Okay. It's for depression. We call it a nature's Prozac. But you have to make a choice whether you're taking a prescription drug or St. John's wort for depression. It's a consumer choice. It's a patient choice. But you can't take both. That's why it's not always safe taking natural or supplements or herbs. Okay. When the other campuses found out, there's 11 other campuses of PIMA that has pharmacy tech program, found out that I take my students to an herb store. They asked the process. How do you do that? I said, first, you're going to find an herb store in your area. And then you communicate with the owner. And they'll have herbalists in there. And they're going to help you out. I'm not an herbalist. They're going to help you with the other plants and ingredients that we have. Luckily, we're close to Latin America. And there are a lot of natural ingredients from Latin America that we use. Okay. Common and severe medication side effects, indications of medications and dietary supplements. I just mentioned St. John's wort. It's for depression, for anxiety. It's nature's Prozac. Yeah. But it should not be given to people taking SSRIs. Okay. Drug stability. You're going to learn more of that during the sequence. Oral suspension. Insulin. Insulin must be refrigerated. The conversion of units to ml. How many units is 1 ml? 100 units is to 1 ml. Scary conversion, because we may kill somebody with that. If you don't know that 100 units insulin is equivalent to 1 ml. Okay. Reconstitutes, you're going to learn how to reconstitute. Okay, oral powder for suspension or reconstitute IV powders for injection. Immunizations, vaccinations. Okay, narrow therapeutic indexes, those with very thin line that separates therapeutic dose and lethal dose. Okay, physical and chemical incompatibilities. You will get your logins for sterile compounding. And you want to remember that there's 3 things that may cause instability of drugs. And it is your out key. Air, light, and temperature. What causes instability of drugs? This shows up on the PTCE. Remember your alt key. Air, light, and temperature. Picture milk on a summer day. You left your milk outside, it's affected by air, light, and temperature. By the time you come back at night, it's already spoiled. Okay? So this always shows up. Causes of instability, alt, air, light, and temperature. Factors that affect stability. Okay? They asked that on the PTCE. Okay? Proper storage of medications. Are not always seen in the eye drop section or ophthalmic section. This is a common question on the board exam. There's one drug, an eye drops, that's for glaucoma. Always a question on the board exam. Where can you see this drug? And then it'll say ophthalmic section is your A. Of course, you're going to pick that, or most students will pick that because it's an eye drops. But the correct answer is refrigerator, because this specific eye drop should be stored in the refrigerator. And what is that eye drop? You say it. Spell it if you want.
Xalata.
Very good. Xalatan. Generic latanoprost. That's a favorite question in the PTCE because it's tricky. Where can you find this eye drops? Letter A is ophthalmic section, but the correct answer is refrigerator. Okay, those are things I know that usually show up from my own experience and from many of my students' experience. In Las Vegas, in that 15 years, I probably have about 100 face-to-face students. In my online review class, I have over 9,000 students, about 10,000 altogether the last 15 years. They always tell me what shows up. So I find a pattern. I find the common ones that show up. And that's why I could spew these things to you. Okay. Next one. Federal requirements. What do you think this is about? Law. Do we have a pharmacy law class? Yes, we do. Those who did law. Did you learn about handling and disposal of hazardous and non-hazardous drugs? Yes. You remember how to dispose of your fentanyl patch? Remember, there's presentations in that. Okay. Controlled substances. Do you know the rules in controlled substances? C1, C2, C3, C4, C5. How many refills for a C2? 0. How long is the prescription good for? You see that? You hear that, freshmen? They're answering as it stays. Okay. What about C3, C4, and C5? How long is the prescription good for?
6 months.
How long is the prescription valid for? C3, C4, and C5? 6 months. Okay. 6 months. How many refills are allowed for C3, C4, and C5? You see that? They didn't memorize that. They know it by heart. Right? I'm letting them flex right now, but you'll be at that level. You'll be at that point where you're spewing the answers. Okay? Because I'm repetitive too. Okay? DEA. Who is the DEA?
Drug enforcement.
Not agency. I said this.
Administration.
Common mistake. Drug Enforcement Administration. What do they regulate? Controlled substances. Anything that may cause addiction or abuse. Okay? Who is the FDA?
Food and Drug Administration.
What do they regulate? Food, drugs, cosmetics, tobacco. Okay? And the laws. You should know. Kefauver Harris, Durham Humphrey, those two always show up on the PTCE. Okay? The RAMs we did last time. RCA, you remember RCA? Root cause analysis. Okay. Next one, next big chunk. Patient safety and quality assurance is 26.25%, which tells you 40 and 26.25 is about drugs and math. Right? Because if you calculate something wrong, don't you think that's patient safety? Yes. So math, though, doesn't only fall on patient safety. It falls mostly on patient safety. If you flip your paper, look at the bottom, there's an asterisk. So some students who I don't know from somewhere, they ask me, is there math? Is there a lot of math? It says some or all of this statement reflects calculation-based knowledge. So the answer is yes. There are students who got only 5 questions on math. Okay. There are students who only got 2 allegation questions. There are students who got 10 percentages questions. There are students who didn't remember if they even got a math. We don't know because it's a question bank and the computer pulls the 90 questions for you when you sit for the test. Is that clear? Okay. But I always have tips every day. So you should have a notebook for it. Okay. Did we talk about LASA last time? Look-alike, sound-alike drugs. And what do we do to help minimize these errors? Always shows up on the PTCE. Okay. Error preventive, using the leading 0 and dropping the trailing 0. Spelling out milligrams and micrograms instead of using mg and mcg. I emphasize this on math. Okay. Talked about root cause analysis, incorrect quantity, incorrect patient, the 5 R's or 7 R's of prescribing. You remember that? Tech duties. Okay, because you have to be giving it to the right patient. Okay. Hygiene and cleaning standards when it comes to sterile compounding. We're the only school that does USP 797 certification included in your curriculum. So that's why we're an advanced accredited program, and that's for the entire state. Okay. The strongest pharmacists are the ones who became pharmacy technicians first. Okay. I didn't become a pharmacy technician before I went straight to pharmacy school because we didn't have pharmacy technicians back in the day. We do everything. Like those OG hardcore pharmacists. Okay. Next one. 21.25% is order entry and processing. Those who did sequence 1 with me, do you think inventory falls under this? Yes. Do you think tech duties fall under this? Yes. So your general pharmacy technician classes fall under this. Okay. Non-sterile products, we're going to do that this time. Ointments, mixtures, liquids, emulsions, suppositories, enemas. Okay. Some of you will make gummies. I know it already. Yeah. Some of you will make ointments, creams, and lotions, or troche. When you're in a closed door compounding, non-sterile compounding pharmacy, you'll make troches all the time, ointments all the time, lotions all the time, hormone replacement therapy in lotions and creams form. Okay. What else? Formulas, calculations. What do I say about ratio and proportion?
You can solve all problems.
You can solve any pharmacy problem using ratio and proportion. I just tweaked alligation using ratio and proportion. Because it's harder for many students to do the fraction way. Okay. SIG codes, you will learn abbreviations. TID. What's TID? What's BID? What's QWK? Every week. What's AD? Right here. And I'll give you ways on how to remember these things. What's AS? AD is aurum dexter in Latin. Okay. If you want to remember it, audio. Dexter, right side. Every time there's a D, it's the right side. AS, aurum sinister in Latin. Audio, sinister is left. How do I remember that D, Dexter is right? Dexter is always right. Okay. Whether Dexter the cartoon or Dexter the serial killer. I love that show.
He's great.
You know where I first found him? 6 feet under. Yeah. And you know when I stopped watching it? That's why I don't like series, because I get hooked so bad. when I got pregnant, I stopped watching it because they said whatever you read, whatever you watch, that's what's going to happen to your baby. I want him to be a serial killer. I don't know if that's true. Yeah, that's why you'll hear a lot of pregnant women listen to like classical music or read a Bible every night and every day, and they come out religious or whatever it is. Okay. So those who listen to music, they're musically inclined, their babies become, I don't know if that's real, but I just stopped watching Dexter. I was scared. Anyway, it's one of my favorite series or shows. So medical terminologies. Anti-hyperlipidemia. Anti is against. Hyper is high. Lipid pertains to cholesterol. Emia is in the blood. So you know that drug is for cholesterol. Anti-hypertensive. Anti is against. Hyper is. Tensive is blood pressure or tension or pressure. Okay. Anxiolytic. Anxi is anxiety. Lytic came from lysis. Think about Lysol. What's that word? Kills. It kills anxiety. I can't make it any more simpler. You think you'll remember that when I start teaching it? I guess so. It doesn't have to be difficult. People just make it to be. Okay. Equipment supplies required for drug administration. Sometimes we use syringes to administer drugs to children, oral syringes. Okay. Or IV, IM, all those routes or routes. Lot numbers. Why is lot number important? For recalls. This shows up on the board exam a lot. What is the identifier for recalls? The answer is lot number. Okay. NDC number. How many digits does an NDC number have? 10 to 11. You know that sometimes this is 5 questions on the PTCE. What's the first 5? Manufacturer code. What's the next 4? Drug or product code. What's the last 2?
Package.
Now, do you know why our students always pass? That's the secret. Okay. Identify returning dispensable, non-dispensable, and expired medications and supply, credit, return. When do you learn this?
Like
1. Inventory, the returns, the borrow, and the loan. We can let another department, another pharmacy borrow, but they have to return it. If we loan them 1 liter IV bag normal saline, it doesn't come back to 500 ml. Has to be 1 liter as well, normal saline, especially in emergency situations. And sometimes those ambulances, I don't know if they still do that, but back in the day, when I didn't know, when I wasn't in the pharmacy field, like that ambulance is empty, but it's running its siren, right? Until I became a hospital pharmacist. We use these ambulances to carry drugs to take to another pharmacy that needs it. And that's why sometimes they're empty. They're carrying a life-saving drug, not only patients. Follow? They're run out. Okay. I didn't know that until I was a pharmacist. I thought it was their job was only that was back in the day. I don't know now. I can ask Ryan, the program director of our EMT program. Okay. Seniors, juniors, and even sophomores, are you confident that you're going to pass the board exam because we cover everything? Think we cover everything and more. I will not let you fail. Not. So if you do, I said if, I didn't say when. Don't want you to. Okay? That's on who? I give you everything. Okay? I'm actually in the process of creating infographics, like for all this drug-to-drug interaction, drug-to-food, drug-to-disease. Okay? I have employees outside. Okay? So I have a graphic artist outside who helps me out. And I'll tell him what to do, what to put. Okay. I like using Canva, but I don't have time. I'm always here. And I get them from outside the country. Why? While I'm sleeping, they're working. And when I wake up, they are already sending what I asked them to do. That's how I buy time. Okay. I also hire pharmacists to double check, to proofread. Okay. I hire my son too, because he's good at writing, to check for spelling. He's a spelling Nazi. My son is. Okay. Any questions? Okay. Freshmen, do you think you're going to be confident once you get to the point wherein you're going to decide whether to take the board exam or not? I think so. Do not fret, okay, because you got everything you need. Okay. I saved